Hello, everyone. Thank you for joining us again for a look into the work of one of our signers. Today, we'll be focusing on the intersection of built environment, land use, and well-being. We are joined by Wellbeing Blueprint signer Elka Gotfryd at the Hudson Valley Pattern for Progress. Welcome, Elka.
Thanks so much for having me.
What are some ways that the built environment impacts well-being?
So the way I like to think about this is the same way I like to think about well-being on an individual level, where you've got your physical health, the emotional health, your psychological health, and all of these elements of health and well-being are intertwined with one another. So if you are feeling any sort of mental stress or any sort of emotional stress, your body may feel that physically. And if you're feeling physically unwell, that may impact your mood or your psychological well-being. Mm. And the way I see it is that fundamental principle of the emotional, physical, and even spiritual well-being, that kind of is magnified on a societal scale when it comes to our cities and towns. So as a planner, when I look at the well-being of a neighborhood or a community that I'm working with, I want to make sure that I'm focusing not only on the physical aspects of our environment, but also emotionally and psychologically what people are showing me and what they're telling me about their experience in that built environment.
What are some ways that planning can undo harms and provide healing for communities that have been negatively impacted by the built environment?
That's a really good question, and one that I try to answer all the time in my practice as a planner. So I would say that as a highly technical field, planning actually needs to transition to be much more human-centric, so that planners are more aware of how, basically the emotional impacts of the decision-making that happens in the built environment. The other piece of it is that there are planners all over the country now working towards reparations through land use planning. So, for example, in Illinois, in response to the historic urban renewal that happened there, one of the council members, I believe, introduced this initiative to use municipal land for reparations for those communities who were displaced by historically discriminatory land use policies that were perpetuated by the federal and state governments at the time. So those are also ways that planners can really advocate to right the wrongs that have been historically done through planning and land use.
And finally, what role does spanning boundaries play in centering well-being in planning and designing the built environment?
Every field of work somehow tangentially is going to run into planning in one way or another, because we're all operating in the built environment. We're all operating in a community or a neighborhood or a city or a town, wherever it is, right? We're operating in space. And so let's take an example of health institutions, right? So some hospitals and health insurance companies are starting to understand that it's more financially viable to invest in housing for someone than ER visits for someone who is, for example, experiencing homelessness. And so to enable the kind of housing and well-being outcomes that come with a housing first campaign, health and equity advocates should be pounding on the doors of the planners and the land use board members to encourage the type of density that would be necessary in order to ensure that everyone has access to safe and stable housing. But there was a story of a woman who had a regular checkup at a hospital every day at 3:00 for an extended period of time. And when her treatments were over, she would start to get panic attacks around 3:30 every day. And she would call an ambulance and they'd rush her to the hospital and then she'd be fine. Nothing was wrong with her physically. But what they realized was that she was so lonely in that moment that she called an ambulance and wanted to go have that exchange at the hospital. And I wonder, when we think about the built environment and how we relate to our seniors, right? As they age, as they live in isolation in their historic, single family homes, for example, without options for them to downsize or move into intergenerational communities, their well-being is affected in a very negative way by the way that we've built out the built environment. And then the domino effect is that our healthcare systems are impacted by that, right? So it's really all intertwined.
Well, thank you, Elka, so much for your insight into how well-being and the built environment and how planners think about land use all intersect. Thank you so much for your time today.
Thanks for having me.